Hey guys, good morning. It's Dr. Lisa coming to you live again from Tampa, Florida, where I am at the front lines of a busy integrative primary care practice as an internal medicine physician. I have enjoyed sharing my thoughts with you throughout this COVID-19 pandemic and wanted to hop on again after a really great one yesterday. I really appreciate you guys sharing what I had to say. I am filled with questions still today, so I wanted to bring up a few more of my whys. We discussed yesterday how curiosity and inquisition is such a sign of intelligence. It's such a sign of you tapping into your intuition, and I want you all to feel more of that. So I figured today I was going to bring up a couple of other things that really got me in my core. I have heard over and over again that when people are dying of all causes in the hospitals right now, that they are testing them. And if coronavirus shows up, the cause of death is being labeled as COVID-19. That to me is a huge why. People are still having heart attacks. People still have cancer. Those patients with cancer, they're likely to get a opportunistic infection or a virus gets seeded into their bloodstream, to their immune system, because they are not able to fight it like the rest of us. So a lot of them are going to have COVID-19 potentially, or coronavirus, on testing. Who is deciding what the cause of death is and why COVID-19 should be listed? So that's what's adding to a lot of the numbers. And it really, again, was a huge why for me. What we probably need to do, and I need all of your help with this, is push for the fact that we need to look at numbers of other diseases and what people typically are dying from, and compare these numbers over this time period. So again, a lot of these questions are not going to be answered right away. As we move forward, we're going to be able to look back, and someone needs to be demanding that we look at the numbers of deaths from other causes, compare them to what the norm is, so that we can explain if the COVID deaths are higher, maybe that's because these patients actually died of their cancer or had a heart attack. That's a huge, huge question that we need to keep going and keep asking. The other question I have is why, if this disease is so unstable, meaning that we keep trying to find the exact mechanism of action. First, we thought it was only respiratory, then we were chasing it through the bloodstream. We are seeing its impact on multiple organs. It seems to be mutating, which a lot of the scientists are noticing and commenting on. And these coronaviruses that mutate, they're not going to respond well to a vaccine, in my opinion. So all of the talk about potential for mandatory vaccinations and getting a vaccine out as quickly as possible, it's going to be similar likely to the flu vaccine, which has only at the most about a 30% efficacy, because the flu virus, as we all know, mutates and shifts. So every year the vaccine has to change. So that's another why I wanted you all to be aware of. When this vaccine comes out, we need to be asking, what is the efficacy? What if it's shifted? What if it has mutated? What does that all mean? And I know our scientists are desperately looking for it. I think there will be a place in the future for it. We're just not there yet. And the risks may very well outweigh any potential benefit. There was in the news a lot of talk yesterday about remdesivir, which is an antiviral drug, sort of similar to Tamiflu, that everyone was talking about a home run and how it's going to change the game. And I found myself again saying why, because the excitement was that it went from a hospital course, treatment course of 15 days of symptoms to about 11. Does that make a definitive change in our outcomes? Does that help our healthcare system in any way? Those extra 3 or 4 days, are they worth whatever the potential side effects are of that drug, which we have not completely identified, and the cost that's going to come along with it? That's another why. Who is behind these medications that we are being fed? That 3 or 4 more days of quicker recovery is going to be such a home run. Now, don't get me wrong, I am adamantly and excitedly scouring the science, looking for ways to help prevent this disease from spreading and help treat those that are infected. I haven't seen it yet. I think that this is going to continue to take us some time. The course of how these viruses work is, again, shifting very rapidly. And we are connecting and dots and we're collecting data, but that takes some time. Then I wanted to ask a couple of who's before we wrap up today. So who is also a really important question besides just why. Who is in charge of YouTube? Does anybody know that? Because I don't. Who's in charge of this social media platform? Who is deciding what we can hear and what we can see? I think we all need to be asking that today as our rights are being just challenged a bit. Who decided to invade a doctor's office in Michigan because they were giving IV therapies like vitamin C, which we have done proudly here for 15 years and have had incredible results with people who are chronically fatigued and other symptomatology. So who is dictating these actions? What I want today is for you to have a quick exercise in your home. Maybe make a little journal of these why, like put a why on one side, a who on the other side, and just make up your own questions. I would love to hear some of them. Share them below. You guys were amazing about sharing my video yesterday. Please share this one so that we can get a communication, a conversation going with inquisitive people who are educated. We are all educated and we're curious, and we should be. So embrace that. Make up your questions today. Drop them below if you would like. And my affirmation to end is this. My curiosity is a sign of my intuition and intelligence. My curiosity is a sign of my intuition and intelligence. Let's explore our curiosity together. And I'd love to hear from you. Have a great day. I will see you guys here tomorrow. Bye for now.